Today the topic of intimate chronic osteomyelitis. Let's go. Osteomyelitis. Osteomyelitis is defined as an inflammation of the bone caused by infecting organisms like Staphylococcus aureus causes two-thirds of the cases and some contagious threats like E. coli also. Infection may be limited to single portion of the bone or may involve the marrow, cortex, periosteum, and the surrounding tissue. Classification. Classification based on duration of symptoms. Acute, chronic, subacute, chronic. Acute is less than 3 weeks. Subacute is between 2 to 3 weeks. Chronic is more than 3 weeks. Of the osteomyelitis. Mechanism of action. Mechanism of action. Based on mechanism of action. Exogenous metabolism. Based on host responsibility. Pyogenic or non-pyogenic. When the duration of osteomyelitis is more than 3 weeks, it is called as chronic osteomyelitis. Causes are trauma, causing post-operative osteomyelitis with chronic etiology like TB, Brodys factors, fungal osteomyelitis, chronic osteomyelitis. Chronic osteomyelitis is difficult to eradicate completely. There are high chances of reoccurrence of this disease. Systemic symptoms may subside, but one or more foci in the bone may contain purulent material, infected damaging tissue, or secretion, which may lead to again causing chronic osteomyelitis. Recurrence is normal. Pathology. In simple, bacteria enters, then glycocytes are attracted to area, secrete enzyme to kill bacteria. These causes obstruction blood leading to decreased blood flow, which causes necrotic bone forming called secretion. What is secretion? Secretion infected dead bone reserved from osteomyelitis. This will develop into involution. Involution. What is involution? Involution is new bone formation around circulation. This is the normal physiological response of the body try to seal the infection by warming the bone. This is the pathology. The bacteria enters, leukocytes are attracted to the area, secrete sometimes kill bacteria, which causes obstruction, which decreases the blood flow. Necrotic bone form called secretion. What is secretion? Secretion is infected dead bone results from osteomyelitis, which leads to further formation of involution. New bone formation around secretion is called as involution. This occurs because our body tries to seal the infection by forming the new bone. Chronic osteomyelitis. The hallmark of chronic osteomyelitis is infected dead bone within a compromised soft tissue envelope. What is it called? Dead bone within a soft tissue. The infected foci within the bone are surrounded by sclerotic, relatively avascular bone covered by a thickened periosteum and scarred muscles and subcutaneous tissue. This avascular envelope of scar tissue leaves systemic antibiotics essentially ineffective for treatment of for treatment of osteomyelitis. Antibiotics only are not effective. Reason? What is the reason? Because they find are difficult to penetrate necrotic area. Antibiotics, we can't give only antibiotics because antibiotics are less effective as they can't enter or diffuse to penetrate the necrotic area and improvise the action. So their actions are restricted due to necrotic area. Chronic osteomyelitis. Secondary infections are common. Semester culture usually do not correlate with cultures obtained at bone biopsy. Multiple organisms may grow from the cultures taken from the semester and from open biopsy specimens of surrounding soft tissue and bone. Multiple organisms can grow from the culture as there are like many specimens around the soft tissue and the bone. Clinically, how does the patient present? Patient with common symptoms are pain and swelling, discharge in bone deformity, joint stiffness, shortening of limb, pathological fracture, semester nudity. These are the common clinical symptoms of patients with chronic osteomyelitis. Kidney and bladder staging system. It is a common classification used for classifying the types of chronic osteomyelitis. It is divided into two types. Three types of questions. Four types of bone infection. What are the three types of patients? One, healthy. Two, compromised. Three, severely systemic compromise. These are the classifications related to patients. Healthy patients are like easy for the treatment. Com- compensated and severely systemic compromised people are little difficult task for the treatment. And the four types of bone infection. They are medullary infection, superficial cortical surface infection because of coverage defect, localized cortical secretion that can be exercised without compromising stability, diffuse features of one to diffuse features of medullary, superficial localized, plus mechanical instability before or after developmental secretion. Medullary. Why is it called medullary industrial disease? Because it mainly affects the medulla. It mainly affects medulla. Superficial. Superficial is only up to the margin. When it affects only cortex part. Superficial. Hence called superficial cortical fractures. And then localized. In this localized, cortex is affected along with some medulla part is also affected. It is usually near, it is usually affected inside. Both cortex and medulla are involved. Diffuse way. In diffuse way, you can see here, like here also. It enters both like cortex and the whole medulla and also comes out. Sometimes it can exit also from one direction to another direction. This is called diffusive, and as you can see here also, it can enter from here to here, here to here. So operating diffusive is more riskier and challenging. Differential diagnosis. Differential diagnosis for chronic osteomyelitis is PV osteomyelitis. What are the disturbances? Previous history of TB, sinus with undetermined margin with blue color. Ewing's sarcoma, a primary malignant tumor of bone usually arising as central tumor in long bone. Primary malignant tumor of bone usually arising as central tumor in long bone. Soft tissue chronic infection. What is diagnosis? Diagnosis is mainly based on clinical, laboratory, and imaging studies. The gold standard method for diagnosing chronic osteomyelitis is obtained by biopsy of specimen for histological and microbiological evaluation of infected bone. Clinical examinations, integrity of soft skin and soft tissue, area of tenderness, affect bone stability, neurovascular status of the limb. What are laboratory investigations done? Blood count, EFR, CRP. In chronic osteomyelitis, ER is elevated. ESR is elevated. Imaging studies. Plain radiography. Plain radiography shows cortical destruction, periosteal reaction, system deformity, and sclerotic bone. The following images depict about sonography of chronic osteomyelitis. CT scan. Cortical bone and surrounding soft tissue and is especially useful in identifying the sequestra. What is sequestra? Sequestra is necrotic bone forming due to blood flow restriction. Sequestra is a infected dead body bone reserved from osteomyelitis. MRI. Extent of pathological insight by showing margins of bone and soft tissue edema. Extent of pathological insight by showing margins of bone and soft tissue edema. Well-defined rim of high signal intensity surrounding the focus of activity is seen. Rim sign is seen in MRI. What is the treatment? Treatment is supportive treatment. Only antibiotics can't. Only antibiotics is less or not useful. Reason can't or difficult to cross. Difficult to cross. Necrotic categories. Hence, Surgery plays a major role. Sequestration and cauterization are important steps and cannot be eradicated without surgical intervention. Sequestration curatoris. This is sequestration, which is removed and clearing all the debris by process called cauterization, then packing. Sinus tags can be injected with methylene blue for 24 hours before surgery to make it easier to locate and express. Methylene blue technique. Expose the infected area of bone and excise all sinus tags completely. Expose infected area of bone and excise all sinus tags completely. Insert the indurated periosteum and elevate it to 1.3 to 2.5 cm on inside. Use a drill to outline cortical window at appropriate height to remove it as a osteotome. Remove it with an osteotome. Remove all sequestrated purulent material and scarred and necrotic tissue. If sclerotic bone seals off a cavity within medullary canal, open it into canal in both directions to allow blood vessels to grow into the cavity. After removing all suspicious matter, carefully excise overhanging edges of bone to avoid leaving a cavity or dead space. If cavity cannot be filled by surrounding soft tissue, a local muscle flap or free tissue transfer can be used to obliterate dead space. If there is non-union present in any bone instability, the bone must be stabilized preferably with Visceral type external fluid. Visceral type of external fluid means use of bone transport. Just, if possible, close the skin loosely over drains and ensure that no excessive skin tension is present. If closure is impossible, crack the wound open loosely or apply an antibiotic bead pouch and plan for delayed closure or engrafting at later. Appropriate antibiotics should be used before, during, and after operation. After treatment, 6-week course of IV antibiotics is given after surgical debridement. The limb is splinted until the wound has healed, and then it is protected to prevent pathological infection. Method described to eliminate dead space. Wound grafting with primary or secondary fluid. Antibiotic polymethyl methacrylate. Leaves temporary filler of dead space before reconstruction. Local muscle flaps and skin grafting with or without bone grafting. Microvascular transfer of muscles, myocutaneous, osseous, and osteocutaneous flaps. The use of bone transport in this arrow technique. Open bone matching. Debridement is very broad. Stage 2, we are going like doing grafting, autogenous transverse bone grafting. Stage 3, wound coverage. Perfume technique. Stage 1, debridement. Stage 2, grafting. Stage 3, wound coverage. In some cases, spontaneous epithelialization. Otherwise, skin graft, myocutaneous flaps, muscle pedicle flaps, three flaps requiring microvascular unfilling. Complications seen in chronic osteomyelitis, joint stiffness, softening, muscle contracture, pathological fracture, tennis malignancy, amyloidosis. Thank you.